Good afternoon and welcome back to the channel. This is Dr. Walker from denwalker.com. So I want to say thank you for the folks who are following me currently on Twitter at Dr. Den Walker and folks who are following me here on YouTube. It's just been an interesting journey. As you know, I've always been sort of interested in health and taking care of oneself. And most recently, in most recent months, I should say, I've been talking a lot about COVID and my thoughts and comments on the vaccine and so forth. So that's kind of what this video is about, or going to be about. Just a short video, however. So a couple of days ago, and perhaps some of you already know this, the CDC now has data, confirms data, that natural immunity is better than vaccine immunity. And importantly, folks who've had natural immunity from prior infection, getting a vaccine on top of that offers no additional benefit. And I think that's profoundly important because there has not been a whole lot of discussion from the CDC, from the NIH, from the WHO, from the Dr. Fauci, from the medical leadership, many of them, regarding the benefits of natural immunity. And in fact, and you've heard, if you've had a prior infection, then it's a wonderful thing to add at least one dose of the vaccine on top of that. And again, I suspect just a marketing technique. You've heard that. You've heard that, it's the natural immunity doesn't last that long, or we have no idea how long it lasts, as though we have data to support the idea that the vaccine lasts years. We don't know, right? And some folks will say it'll last a few weeks, a couple of months. But natural immunity, again, if you have been following me, you know that I've said before that people who have had immunity from SARS-CoV-1 had protection still 20 years later in SARS-CoV-2 as well. So again, for me, this is profoundly important. I like the idea, or know that the things that many of us have been discussing online, on Twitter, on Facebook, on YouTube, that natural immunity is better than man-made synthetic material. It's just a confirmation again, because there's so much arrows flung at many of us, because we're sort of saying what seems to be preposterous to some people. And again, the idea is that you can have a vaccine that triggers immune response against the spike portion of the virus, as opposed to natural immunity, which gives you antibodies against not just the spike, but the capsid, just nuclear protein, the entire thing. I do not, or did not, see how that synthetic could be better than that. I don't know, but yet many of us had been saying that. Now, what some have been also saying, which, and again, it doesn't really mean a whole lot to me. There are some people now who are, quote, getting an infection who've had, let's say, Delta before. Now, Omicron is like the cold, right? And you get a cold once and you can get it another couple of months and maybe another year or so. But the important thing is that, as with Delta, for example, the death rate for Omicron is almost zero, right? Death rate from Delta was not so. And yes, Omicron is a little bit different than Delta, in that now you can actually have some sore throat, some running nose, some cough, those kind of things. But typically they're not putting you in the hospital, especially if you had natural immunity already. Now, they did also look at people who had vaccine and had no immunity before, how they fared. And again, I'm not telling folks to go out there and try to get Omicron now, and that's not what I'm saying. But I'm saying, if you are relatively healthy, if you have kept up with some of the things I'm talking about, vitamin D, vitamin C, zinc, quercetin, if you're doing that and you're otherwise healthy, your chances of hospitalization is much, much, much lower. That's my opinion, my thought. I think if you are relatively healthy and you're taking some of those supplements I mentioned before, your chances of having hospitalization and death is low. The vitamin D part I've been pushing for a very, very long time, and I've asked folks if they could look at getting their levels checked, and if their levels were upwards of 80 to 100 thereabouts vitamin D levels, they were pretty well protected. Now, the folks who have succumbed to Delta before, many of them, in fact, I heard 75% of the people who actually succumbed to Delta had probably 4 underlying medical conditions, right? So they had typically diabetes, they had hypertension, they had hypercholesterol, they had at least 4 other things, many of them did, that, weaken the system. And so those folks, again, should be really looking at, natural foods, walking, hydration, vitamin D, vitamin C, all of those things should be in concert, helping them to do well long term. So again, I think if you were to stick to that, I think people would do very good long term. Now, I haven't had the vaccine, and folks are asking me on if I had the vaccine. I'm not vaccinated. And, folks are worried and scared about the term, anti-vaxxer. I care nothing about that, right? If folks are thinking I'm an anti-vaxxer, then fine. Whatever you're thinking, my goal for those who are following me, and my goal for myself and my family, again, sort of the same bucket. None of us have had the jab. We're all sort of doing what I'm talking about here. And we're doing fine. So again, the goal is for us essentially to weather the storm. At some point, we'll all have an exposure to Omicron, right? And the vaccine is supposed to help you with symptoms, right? It helps you prevent hospitalization and helps you prevent death. The caution that I have for myself and my family is what else does it do long term, right? There's a lot that I read that worries me about what happens long term. I do. And so the risk that I'm taking is, do I want to be protected a little bit now from hospitalization from what I consider to be the cold, against the risk of taking a jab, which I have no idea what's going to happen long term. That's my caution. And again, CDC, Pfizer, most folks will tell you it does, and to some degree it does. It does help you prevent death and hospitalization and severe illness. That has been the mantra now for some time, and I can't argue that. The question still I have is, what else does it do? And that's the worrisome part, and that's the reason I'm doing what I do. And for the folks who are following me, again, thank you for doing that. But I feel somewhat vindicated, knowing now that the things that some of us have been discussing for the last year plus, that natural immunity, if you were to get it, if your system was robust enough and you were to survive, I think you're protected long term. Anyway, thank you for listening. God bless. Take care. Bye-bye.